Welcome to Pawsitive Partners, and again this week we're doing part 2 of the the tick show. So we're talking about ticks and how to keep them off your dog and you, because these ticks that we have out there carry a lot of diseases that really can affect your life and your pets. So stay tuned.
And what do you do if you think your dog or you is sick? Okay, all right.
Hey, thanks for staying tuned, and we're talking about ticks. And it used to be when I was growing up, we just had these big ticks.
Dog ticks.
And it was no big deal. You pick them off and you go on with life.
And it didn't matter how you picked them off, because they didn't carry illness to any great degree, and you weren't going to get sick. So if you took them off, by lighting a match to them, or putting nail polish on them, or whatever the old wives' tales were, didn't matter. Now it matters how you take them off, because these ticks more and more are harboring diseases in their bodies, bacterial diseases. So
once it can change your life, because
it can throw your life upside down.
It can put you down, possibly, or at least your dog.
Yeah, or people. Actually, neurological problems. We're talking about ehrlichiosis. We're talking about Lyme disease. We're talking about anaplasmosis. All these are tick-borne diseases, and they are on the move. There are some areas of the country where virtually all dogs will eventually test positive for one of these diseases. And in our area, inside a county in southern Ohio, this is getting to be more of a problem. So we'll talk about how do you keep them off you, and how do you keep them off your dog, and what do you do if you think your dog or you is sick. So just a story about how common this is. I was getting my oil changed, and there are just 4 of us there. One of those other guys had a relative who had been deathly sick from a tick-borne disease. And then I was talking about my vets, and the receptionist had a tick-borne disease. She didn't know she had it on her until she felt pain between her toes. And
oh, wow.
Yeah, that's where ticks can get. And I'll show you where to look on your dog, and the obvious places to look on yourself. But
in the previous show we recorded in here, one of the people told me that they knew 2 people. They knew 2 people that had gotten bit by a tick and then became allergic to everything meat besides fish and chicken.
There is that meat allergy
pork
that
and
happens
beef and
with some ticks. I think
it's crazy.
Yeah, it is, and it's just more and more of a problem. So I'm not here to
this makes me not want to go outside.
Well, yeah. Well, and on that point, I'm going to be going to the Outer Banks to take some lessons about kite surfing, of all things. But anyway, I was talking to the guy who was setting up the lessons, and I asked him about ticks, because ticks are really common in the Outer Banks. And
not in the sand.
Well, they're in the marshy areas, and the grasses, the marshy areas. Anyway, it turns out he said, well, he knew more about Lyme disease than he ever wanted to know about, because his wife got bitten by a tick as a teenager. She was treated for it, but she's now chronically ill.
Wow.
So
what's chronically mean? Is that like kidneys or liver or what?
These bacteria are in the class of spirochetes. I don't know what the correct pronunciation is, but anyway, those are the type of circular hooking bacteria that are the syphilis bacteria. So these diseases can cause joint deterioration. They can cause neurological problems. They can cause cognitive problems.
Wow.
So, so let's talk about how do you keep them off your dog. So on your dog, you're going to, and last time we talked about, how do you get them off. What you want to use is either a tick removing tool. Yeah, there we go.
Yeah, tweezers?
Yeah, tweezers, a fine point tweezers, because you want to get at the point of attachment, just at the head of the tick, ahead of the head of the tick there, on the mouth parts, and then pull up.
You don't want to get a hold of
You don't want to get a hold of the body and
that's
squeeze
like a balloon.
that stuff back into you, because that's where the bacteria are. And so
right.
what you, okay, not all ticks have these diseases, but it's getting to be more and more common. And out there in the Outer Banks, this guy with his family, they go to two places in the summer. They go to the beach, directly out onto the sand, or they stay in, in paved areas around their house. That's it. Okay, so with your dog, check your dog daily. Have your dog on a flea and tick preventative on a monthly basis, but bear in mind that does not repel ticks.
They may not stay on them, but they'll still get bit. Right?
Well, the only thing that what flea and tick preventatives do is they poison the tick. The only way they poison the tick is that tick has to bite your dog and ingest enough of that chemical to kill it. At that point, the question is, have they injected their body fluids? Have they gotten enough fluid in themselves, enough blood out of your dog that they have then pushed some of that fluid back into your dog? So it doesn't keep them from biting. It doesn't keep them from, from pushing that fluid back into your dog and infecting their dog. The hope is that that'll kill them before they do so. Right. So, but it's a good step. It's an important step. So with your dog, check around your dog's eyes, because they can be around the eyelid. Check behind their ears. Check inside their ears. Okay. You want to check under their tail. You want your dog to be used to body handling. So, you use reward to get them used to that, use, affection and all that sort of stuff. That way they're accustomed to body handling when they go to the vet. You want to check underneath their leg here, where in that crease where skin is exposed. You want to check back here, in the crease where skin is exposed here. And you also want to check, of all things, we're talking about that person at the vet's office, receptionist, check between their toes.
Yeah, I've seen some pictures that are pretty gross online of just all kinds of ticks just filling up the areas between the toes.
Right. And then I check under the pads of the feet here, So you want a lot of dogs are uncomfortable with their feet being handled, because their feet are their, getaway tools. So you get them used to that. And that also helps having them get used to nail trimming and so forth.
Do you think shorter haired dogs are more susceptible?
I don't know.
I've got a short hair, and I've got one that's extremely hairy.
Yeah.
And I don't know how I could find on the real hairy guy, but I was just hoping that, the ticks and the mosquitoes probably couldn't get through that undercoat and everything.
Okay, and what you can do, we're talking about what you can do for ourselves and our dogs is you can use a repellent. So you mentioned something with Picardin, P-I-C-A-R-D-I-N, and then there's DEET. And that's something that you can put on the coat of your dog, and it's the balance is that I looked at the toxicity stuff, and obviously this stuff isn't a food additive. It's not something that's a desirable thing to add to anybody's system or a dog's system. But on balance, it doesn't seem to be noticeably toxic with normal use. So you put it on your dog, and you put it particularly in those areas where the dog might be affected, and that helps as well. Some people
I know the
use
Picardin stuff. We've been using it for the past couple of weeks.
Yeah.
and you know the flies and different things really bother us when we go outside. Put a little spritz of that stuff on.
Right.
Not a problem.
Okay, that helps.
It really
and also
works.
can be preventing some bites from mosquitoes that could transmit heartworm, which is transmitted by mosquitoes. So we've got that. And another thing you can do for your dog, this is a dog running suit, exercise suit, that is called a Hurtta, H-U-R-T-T-A. I have one for Bo. And my dog's a pretty big boy. Anyway,
I don't know if they'd make one as big as mine.
Yeah. This is the extra large. So anyway, the neck here, the front legs, the back legs, it does have a place so the dog can go to the bathroom, which helps.
Yeah.
They're not going to give you a, hey, number one, number two, you're not going to get that. This is realistic. So you put this over the dog's neck, you put their front legs through here, you put their back legs through here, which is pretty easy since it's split. And this is treated with something called permethrin, P-E-R-M-E-T-H-R-I-N. And that is something that, so what that does is, if a tick crawls on this material for 10, 12 inches or something like that, it's going to absorb enough chemical in its system that it will kill the tick. And this is also something we can put on our own clothes. Now, you don't put it on a dog wet, okay? You don't put it on the dog itself. This stuff is also toxic to cats. In whatever shape or form. So you want to, now once it dries, then the risk is minimal. But you don't want to have this wet stuff around cats. It's
so it's a cat repellent for dogs too.
It's just it's toxic.
Yeah.
So it's also some people spray it on their horses and so forth. Anyway, so we can put it on our own clothes. This is Sawyer's insect repellent. Permethrin treats garments and do not apply to skin, apply to fabric. Only you spray it on there, get the fabric good and damp, and then let it dry. And then that has the effect, again, of protecting your...
So you wipe it over the dog after the material's dry?
No, this has permethrin in it, and that's the only way that you would have
you don't put it on their fur. Okay.
No. Percardin or DEET, on them just like on us. On our clothes, and if you have like
or if they had
a jogging suit.
A bigger dog, you might have something to carry stuff.
Right, and if you have their backpack or something like that, treat that with permethrin. Or even your leash, because one way to find out if there are ticks in an area is you drag a cloth or you drag a line through there, and those ticks will be apt to grab on. So if you've got a long leash or something, spray that with permethrin. So you spray that on your clothes, and that will be a big help. If you are in a tick-infested area, big help, tuck your pants into your socks. Because otherwise what ticks do is they crawl up your sock and then they crawl up your leg. And then where you'll find ticks on people is obviously, in ears, the hairline, at places where there are bands, that compress and tick can't go any farther on someone's body.
Yeah, I haven't been in the woods for like probably 2 years. And the last time I went in, I had 30 of them on me.
That's wild.
I mean, they're the really small ones.
Those
and you can't
are deer
tell.
ticks.
And
right,
so
right.
I haven't tried it, but a lot of people say just use those lint rollers to pick them up.
Okay, and that's a good point. So when you come in after being, so you want to check yourself after you come in from being out. Take a shower within. If you've been out someplace where there's a risk for ticks, take a shower, use a washcloth. So rather than using a lint roller,
your clothes and put them outside or in the dryer.
If you put your clothes in the dryer for 20 minutes, then that will
they'll kill the
that'll
ones that
kill
are on
them.
them.
Right, right. And permethrin holds up pretty well too. Well, some of the tumbling
Washings.
around is gonna knock the permethrin off. If your clothes are treated with permethrin, then the ticks are probably not going to be on your clothes, because that will have killed them. But isolating your clothes and maybe giving a little spritz of permethrin or something like that, and putting it in a bag and then bringing them out, just a little retreat, that would make sense. So take a shower, take a washcloth, just without soap at that point, because you want to be brushing ticks off of you that are just crawling around and haven't adhered, and you want to take a shower so they get flushed down the
Drain.
Drain. Thank you.
Technical words.
Technical word. It was just like, what is that? Anyway, so that thing, we all know. Anyway, so.
And one of the worst things with me is the dogs may go outside and mess around in the grass, and then they come up on the couch with me. I'm sitting here, and they crawl from them to me.
Exactly. Right. Right.
So even though I haven't been out, it's like, hey, there goes one.
So that helps if you've got one of these Herta suits on the dog, and they range from small to really pretty large, 75 pounds or more, extremely large dogs. They might be able to make one custom or something. It's a designed in Finland. Anyhow, so check your dog. You feel over your dog. You also check yourself. Anything that you want to use a mirror, and have a.
If you don't have a partner.
If you don't have a partner who likes you, a lot, then you want to have a mirror so you can look, into a full-length mirror and then go from there.
That's tough when you got those little teeny ones.
And that you just may not find them until they have engorged enough to be noticeable. All right, so.
I don't know if that's a country song. I'll check you for ticks if you check me for ticks or something.
So if it isn't, it should be. Yeah, right.
So assume you have gotten bit, or the dog has gotten bit. What can we look for as far as symptoms?
Well, if you've gotten bitten and you want to save the tick, you can take it off, put it in a baggie, and then seal it, and then put it in another baggie and seal it. If you want to kill the tick, you can kill it with rubbing alcohol. So dump some rubbing alcohol in there, and that way you've got
the fumes will
that,
get it.
Well, or the liquid. Yeah. You can try freezing the tick. That'll kill some ticks. It doesn't really kill deer ticks. But it'll immobilize them, certainly. And if you've got them double bagged, then what you can do with the tick is you can send it off. You can look on the internet and find some service, either a state agency, or take it down to your local the county agent who's agriculture. The
extension.
County extension. Have them look at the tick. You can send these ticks off to have their genetics analyzed to see if they're carrying a disease, but that really doesn't tell you much, because even if that tick tests positive, you don't know if it transmitted. If it tests negative, well, there are false negatives anyway, but but you don't know. You might have been bitten by another tick. So 1 out of 3 people who have Lyme disease don't even know they were bitten by a tick to begin with.
And when you get that bite, I know the newer ticks will make you itch pretty bad.
Yeah,
but
a rash will come up.
The Lyme disease looks like a bullseye.
Yeah, it can, about 2/3 of the time you'll get that.
Yeah.
It's actually lucky if you get one of that, because then you have a clear indicator. You've either got this southern tick allergic reaction, inflammation thing, starry, whatever that is, but that doesn't cause neurological problems, or it's Lyme if you're seeing the bullseye. But you ask, what are the most common symptoms of tick-borne illness? They kind of group fevers and chills, aches and pains, rash. We were talking about Now, this rash, the onset of these problems can be anywhere from a few days to weeks to other symptoms might be for months, not appear for months. Then skin ulcers in some, and also I was seeing an MD that was in Martha's Vineyard, which is the northeast along the coast, and they just have a lot of Lyme disease and so forth. And she said that with children, a lot of times their main symptom is headaches. So now with our dogs, so
yeah, how would you can't tell if your dog has a headache, or I guess you could tell if they had a fever. Maybe, if you touch them enough. And in dogs, like in people, there are stages of these diseases. There's an acute stage, and then hear this from the vetinfo.com, acute stage 1 to 4 weeks after infection, subacute or subclinical. At that point, things have kind of stabilized for the dog, and the lab work may show some slight abnormalities. The dog's weight stabilized, and the parasite's relatively inactive, but stress and other illness can bring the disease into an active state again. A chronic stage, at least this is talking about dogs, is when the parasite moves into attack mode, impacting the dog's immune system. It's often affected one or more organs of the body. At that point, it's difficult to treat. Symptoms in dogs of all these various diseases can include diarrhea or incontinence, vomiting bile, which is yellow, frothy, doesn't look like normal vomit, increased thirst due to dehydration, lack of appetite and weight loss, lethargy, weakness, arthritis or lameness in one or more limbs. That can shift around from one limb to the other. Back or neck pain, swelling of the extremities, neurological symptoms such as seizures, obsessive compulsive behaviors, palsy behaviors. The dog might just start acting differently or irritable because it doesn't feel well. Paleness of the gums and mouth, problems with the eyes, bloodshot, glassy eyes, retinal hemorrhaging, discharge from the eyes or nose, lightening of nose color, nosebleeds, blood clotting issues, a number of things can show up with vet tests. So with your dogs, we're talking about vet tests here. What vets can do is at least once a year anyway, have them do a screen for, it's a blood test and they can get it done, it's reasonable cost, and it can screen for heartworm or lichiosis, anaplasmosis, and Lyme disease. And so you'll find out from that whether your dog has been exposed. At that point, your vet will look at your dog and see, does your dog look like they're sick? If it's the first time through, the chances are they're going to treat with an antibiotic. And the antibiotic, from what I understand, is doxycycline. There we go. Okay.
All right, so it's used for treating ehrlichiosis. In the early stages, the earlier you catch things, the easier it is to treat and the more successful it is. The later things go, just like people, the more challenging the treatment's going to be and the more aggressive the treatment and long-lasting the treatment's going to be. Just one dose, from what I'm understanding, one dose of an antibiotic isn't going to make much difference. So if a dog tests positive, that shows they've been exposed, chances are you'll have a discussion and chances are good that the vet is going to treat. With people, if you're feeling sick, it's a two-stage test. There's anyway, there are two stages of this. With people, it's really a challenge to diagnose. All these diseases are challenges to diagnose, both for vets and MDs.
They don't have really clear flags.
Yeah, they're really not clear flags. So it's just like you feel bad. Your dog doesn't look good. You know, they're not acting themselves.
Do they eat something? Do they do something? You know,
yeah.
it could be hard.
Right. So
So a blood test about the only thing.
Blood test. Now there is something hopefully coming out for people. I read about in a science article that will do a much better, more specific job of screening for people. But that'll be in next year, if that makes the grade. So talk with your doc. If you've saved the tick, at that point, if you're feeling sick, you're going to get treated. Mm-hmm. Don't wait to get results back from a tick. The results from these tests do take a little time to develop, because a person has to develop an immune reaction. They have to develop a defense response against this infection, and that doesn't happen like right away. Mm-hmm. So anyway, ask your doc if they're knowledgeable. If they're not particularly aware, if they say, well, Lyme disease doesn't happen in southern Ohio.
Yes, it does.
Our vet's diagnosing a case a day. They've had over 100 cases of Lyme. They've had over 100 cases of ehrlichiosis. So if you need to get a consult for either your animal or yourself, do that. So that's the world we live in with ticks. It's manageable, but you can't just stick your head in the sand, because you're liable to come up with a tick.
So hope we haven't made you feel all creepy crawly all over, because that's what usually happens when we talk about little parasites.
Take action. So
right.
All right. Well,
take care and watch what you do in the woods, or in the yard for that matter.
Yeah.
So, thanks for watching.
Exactly.